Any doubts, no? Before going to the subject or topic? Niteshri, your doubt?
So my first question was with respect to the menstrual cups that we use, if we are using it in a normal basis, like does it cause any kind of prolapse? Okay. So
No.
that doesn't have anything to do with the prolapse, right? As
No.
far as we are using it in the right way.
Yeah, huh. But hygiene and all things, those parameters, if you take into consideration, then I'll go to PCOD and PCOS first. I'll discuss a little bit about PCOD and PCOS. So, firstly, we'll talk about PCOD. PCOD and PCOS are totally different. Many people think that they both are same. Whoever are walking into our studios or maybe online, they think, I have PCOS. It's a general terminology which very usually and commonly we use. Ki, yeah, I have PCOS. If irregular menstrual cycle, PCOS, but it is not PCOS. The day-to-day life, what we are seeing in maximum females, I would say right now, this generation is PCOD. PCOD is polycystic ovarian disease and PCOS is polycystic ovarian syndrome. Now, the both outcome is same, but the way they both are coming, the causal factors are different for both of them. In PCOD, ovaries do produce one egg. This we have seen in our first class, right? PCOD condition, what is happening is one egg which is releasing, right? That egg will not be completely mature in PCOD condition. So in PCOD condition, what happens is these eggs will be partially mature or immature. So what happens? These partially immature, that means half they get collected and they stay inside the ovary itself. Now this once they are getting collected, what happens? The ovaries grows in size. Obviously, what happens inside that? Then cyst develop. Cysts are nothing but small kind of ball like a structure in which fluid fills up. So this is the origin of PCOD. And because of this reason, what is happening? Yes, please.
So you're saying that the immature eggs are not released then. Instead, they start accumulating inside the ovary. That's what it is, right?
Correct. Yes, absolutely.
So obviously the person has irregular menstruation cycle, and the reason is that the egg is not really released. Is that
Yes,
the
correct.
thing? Okay.
Yes. So these eggs are not completely developed. So these immature things are staying inside it. Now, what is happening? Obviously, we do have hormonal changes, but we also produce male hormone actually. But it is negligible. We are female, so obviously our dominancy of female hormones will be. But due to collection of this cyst, what is happening? The male hormone it produces. Matlab, now that plays role. That's the reason females, if you see whoever are having PCOD condition, you can see they'll have typical hair growth, especially mustaches. Yani to they can even have here little thick hair, chin line. You can observe that, and they'll have little darker pigmentation around the neckline or nape. Right? This we can observe. So this the main origin is this for PCOD. For PCOS, if you see the origin is from the endocrine system. It is purely related to the system. Due to this endocrine system, what is happening is the cysts are formed, the cells are formed, the ovaries are developing, but the ovaries are not released. Why it is not released? Because of the testosterone levels are high. So it is a defect or the default of the endocrine system. Here, there's not like partially mature cells or halfly mature cells. It is mainly because of the endocrine system. Because of that reason, even if the cells are the egg is formed, still the egg is not coming out because the testosterone levels are high. Okay. Now, is PCOD a problem? Yes, Soumya.
Ma'am, you said PCOD will be having many cysts, but PCOS may not necessarily that there'll be many cysts, is it?
No, no, not mandatory. Because there it is getting collected, the immature cells are getting collected and then it is forming. Because of that, your testosterone is increasing. But यहाँ पे not mandatory, it is happening because of the immature cells. Here आपका endocrine system is only involved, because of that
It's
functioning
developed.
it is developing. The main reason when it comes when it bothers PCOD is fertility. That is what main, right? Fertility. So why it is bothering whenever a female is having irregular menstrual cycle? Obviously, it does hamper the fertility. Why? Because when a female is not having irregular menstrual cycle, then you can't expect the ovulation process also to happen. Because of that reason, this thing will come into the picture whenever a female is having irregular menstrual cycle. But PCOD, as I told, it can be corrected. Next, complications. So in both of the conditions, if you see, there are little difference. Main difference, if you see, PCOD may irregular menstrual cycle will be there. Many females, you can see little obese conditions also. Obesity.
Obesity means really, really, really fat.
No, no, not.
Obesity, that word implies that you have
Yes.
a lot of fat on your body. So is that like a symptom? Or, I mean, it can be, people can be PCOD with less fat also, right?
Yes, yes, less fat also. I'm saying that what are the complications if PCOD can have in the future? This mainly this. Then excessive hair growth. If you see the main difference between PCOS and PCOD, in short, I'll tell PCOS is endocrine related, and PCOD is mainly because of the metabolic or lifestyle. Hormonal also, but rarely. But this is mainly because of the endocrine. PCOS minimum number of cysts. PCOS is mainly because of genetic, even because of the lifestyle and because of the endocrine system involvement. And PCOD lifestyle, metabolic, and genetic also here we can consider. But now common signs, if you see in both of the cases, usually we are saying because of the irregular menstrual cycle, and few conditions what happens is female can not have even menstrual cycle at all. Few conditions they'll have scanty flow, like just now you were mentioning, like one of Jyoti you were mentioning, like she's having scanty flow throughout. Few of them can have scanty, that is called as oligomenorrhea. Few of them can have heavy bleed, that is called polymenorrhea condition, and few of them will not have at all. Either of the conditions we can see any kind of irregularity in menstrual cycle, high low absence, is considered this kind of issues, right? Next, you can also see acne over their faces, pimples, acne. This is also very common. You can observe. Now, in short, usually whenever we have PCOD, PCOS, straight away we go to doctor to get a treatment. So again, line of treatment here would be either conservative and again surgery or any kind of procedure. So conservative treatment, they usually give you pills which are hormonal pills or birth control pills. The one thing which is very commonly practiced for irregular menstrual cycle is birth control pills. Okay. Now, common myths, we'll see what are the common myths and facts when it say that PCOD, PCOS cannot be treated. PCOD can be definitely treated with little bit of lifestyle modifications and diet corrections and all things. PCOS can also be corrected when the fertility issue is bothering, that too with any kind of medications or the treatments. And PCOD or PCOS, many people, as I told, they term it as polycystic ovarian. It is not polycystic ovarian in case of PCOS. It is called as PCOS, but doesn't mean that it should have many cysts. It is mainly because of the testosterone levels. Yes. It's not only for you guys. Whoever needs anytime, any help, yes, I'll be there. Definitely.
Thank you, ma'am.
Ma'am,
Okay.
for pranayam, you said like Bhramri and
Bravari.
then Mudra, Vini Mudra they can do in this condition, or we should not.
They can do. They can do. It will help. It will
No,
strengthen that area. We can do.
I thought that they I don't know, like in that condition, if that worse the condition is like they are bedridden, so they can contract or expansion that
They
that
can
they
do.
can do. Or,
See, Kyora, when you're trying to contract and relax the lower area, तो lower area का जो back muscle है, it is holding your back. So it will
Mhm.
strengthen it. You can do it.
Okay, so like how, like we can give 7 reps or like that, like few
Easily you
few
can
rounds.
get 5. Maybe start it with 10 to 15 starting days, then give repetitions. And once they're near to delivery, you can increase the counts.
Okay, thank you, ma'am.
Okay. Okay.